Welcome to the deep dive. Today, we're plunging into a topic that honestly touches so many lives, often in ways people don't fully recognize.
hmm
We're exploring what our sources call the cost of caring. It's about a pretty profound psychological condition known as compassion fatigue.
That's right. And our mission today for this deep dive is really to get under the skin of compassion fatigue. What is it really?
Yeah.
How is it, different from the general burnout we hear so much about? How does it creep up on people? And crucially, what can actually be done? How can it be managed, maybe even prevented? This is it's vital stuff for anyone who really gives a lot of themselves to help others.
Absolutely. So let's start right there with that core idea. Compassion fatigue. You said it's a psychological condition. Can you unpack that a bit? What is it and who tends to experience this?
Okay, so at its heart, compassion fatigue is this deep emotional and physical exhaustion. It develops when someone is just constantly exposed to the suffering, the trauma of other people. It gets to a point where their own ability to empathize, their capacity for it gets overwhelmed. It can even start to diminish.
Wow.
We see it a lot in, the expected fields, healthcare, social work, emergency responders, therapists, but also importantly, family caregivers. Really anyone whose daily life involves bearing witness to significant distress.
The cost of caring. It's such a fitting phrase, that sense of spending your emotional reserves.
Exactly.
But, okay, lots of people are exhausted by their jobs. Stress is everywhere. So what really separates this cost of caring from just, standard burnout?
Yeah.
They sound like they could overlap.
That's a really critical distinction, and the sources are clear on this. Burnout, well, that's more about chronic stress from any demanding job, right?
Yeah.
Could be workload, lack of control, unfairness, whatever.
Okay.
Compassion fatigue, though, is specifically rooted in something called secondary trauma.
Secondary trauma. What does that mean exactly?
It means it's not trauma that happened to you directly, it's the emotional residue, like the impact you absorb from witnessing or hearing about someone else's traumatic experiences.
Ah,
Our brains, interestingly, can process this kind of reported or observed trauma in ways that feel very similar to direct experience. And over time, constantly soaking that up, especially without enough time or support to process it.
it just builds up.
Precisely. It leads to this profound emotional depletion. The caregiver starts feeling detached, maybe numb, cynical, right,
Yeah.
where they used to feel that deep connection and empathy.
So it's less about the long hours themselves and more about the emotional weight of those hours.
That's a great way to put it.
And you mentioned it's not like flipping a switch. It sounds like from our sources, there's a sort of progression, a way this develops over time.
Yes, absolutely. It's usually a gradual thing, a slow erosion, maybe, not a sudden collapse. Typically, it unfolds in stages. First, there's what you might call empathic engagement. This is where the helper is deeply invested, really connecting with the person suffering. That's what makes them good at what they do.
Right. That connection is key.
But then comes prolonged exposure to suffering. Just repeated trauma, grief, crisis situations, day in, day out, often without enough downtime or resources to recover properly.
Okay, that sounds draining already.
It is, and that leads to the next stage. Emotional depletion. Your internal coping mechanisms, your reserves, they just get stretched thin. You feel exhausted on a really deep level. And then if it keeps going unaddressed, it can lead to reduced empathy. The caregiver might start feeling distant, maybe cynical, less motivated. It's like a well slowly running dry.
That image of a well running dry, that really hits home. It sounds incredibly difficult. So if someone is going through this, what does it actually look like day to day? What are the signs, the symptoms someone might notice in themselves or maybe their friends or colleagues might see?
Yeah, and the tricky thing is the symptoms can be quite subtle at first. They creep up.
Right.
Emotionally, you might see things like numbness, feeling irritable all the time, a persistent sadness or hopelessness, maybe just feeling detached from everything.
Okay.
Cognitively, difficulty concentrating is a big one.
Yeah.
Maybe more negative thinking, cynicism, or feeling like you're just not effective anymore, like nothing you do really helps.
That feeling of ineffectiveness must be tough in a caring role.
Absolutely. Physically, it takes a toll too. Chronic fatigue, headaches, sleep problems, trouble sleeping, or sleeping too much changes in appetite.
Wow, it really affects everything.
It does. And behaviorally, you might notice someone withdrawing socially. Maybe their productivity drops, or they start, perhaps unconsciously, avoiding certain patients, certain types of cases, the ones that are most triggering.
So this brings up a really important question. Thinking about all these caring professionals, who is most likely to experience this? Are there certain factors that make someone more vulnerable to this cost of caring?
Yes, the sources definitely point to several risk factors, and some are a bit paradoxical. For instance, people with naturally high levels of empathy, the ones who invest deeply.
The really good ones.
Exactly. They can actually be more vulnerable because they absorb so much. Their emotional sponge is just more active, you could say.
Yeah.
Another big one is poor boundaries between personal and professional life.
Hmm.
When the weight of the work constantly spills over into home life, there's no escape.
That makes sense.
A personal history of trauma can also play a role. Certain situations at work might resonate with past experiences, making them much harder to handle emotionally.
Ah, okay.
Yeah.
More triggering.
Right. And then there are the more perhaps obvious factors, simply being overworked, not having enough time or energy for genuine self-care, and really critically, having limited social support or maybe institutional support within the workplace.
Yeah.
If you don't have people or systems to help you process those difficult emotions, it's like trying to carry that weight all alone.
Yeah.
It multiplies the risk.
It really paints a picture of how different factors can converge, like a perfect storm for vulnerability.
Mm-hmm.
So let's widen the lens a bit. If this compassion fatigue takes hold and isn't addressed, what happens then? What are the consequences, not just for the person, but maybe for the people they serve, the community?
Oh, the ripple effects are significant, really significant. For the individual professional, untreated compassion fatigue often leads to worse job performance, lower satisfaction, maybe just feeling completely disengaged.
Right.
It's a major driver of absenteeism, people calling in sick more often, and high turnover rates in these critical professions. Think about nurses, teachers, social workers leaving their fields.
Which impact the quality of care for everyone.
Absolutely. It strains the whole system. On a personal level, it can really damage relationships. Emotional withdrawal, irritability, that takes a toll on family and friends.
Yeah, I can imagine.
And perhaps most seriously, it can spiral into more significant mental health problems, chronic depression, anxiety disorders, sometimes even substance abuse as a coping mechanism. It's a crisis for the caregiver, definitely, but also for the essential services they provide.
Wow. That really underlines why this is so important to talk about and address.
Yeah.
Okay, so it sounds challenging, deeply challenging, but what can be done? Is it preventable? How do people manage this cost of caring if they realize it's happening to them?
Yes, absolutely. And this is the hopeful part. The
Yeah.
sources offer very clear practical strategies. It's not hopeless. First and foremost, prioritizing robust self-care. And this isn't, bubble baths and candles, though those can be nice. It's non-negotiable stuff.
Like what specifically?
Like getting enough actual rest, making time for hobbies, things that bring joy and are completely separate from the caring role, regular physical activity, healthy eating. These things actively help shift focus from others back to the self, allowing for recovery.
So active replenishment, not just stopping the drain.
Exactly. Establishing clear boundaries is also huge. Learning to limit emotional engagement when necessary, saying no sometimes, protecting personal time, that's crucial.
Okay, what else?
Debriefing and peer support are vital. Just talking through difficult cases, sharing the emotional load with colleagues or supervisors who get it, it helps process that secondary trauma instead of letting it fester.
Having that shared understanding must be key.
Immensely. And for deeper issues, professional help therapy or counseling is incredibly valuable. Having a trained professional guide you through processing these complex emotions.
Right.
And finally, incorporating practices like mindfulness, meditation, simple breathing exercises, or grounding techniques into the daily routine. These help manage stress in the moment and build long-term emotional resilience. They help you stay present and regulate your responses.
It sounds like these need to be seen as essential tools for the job, really. Not luxuries or add-ons, but core practices for anyone in these demanding fields.
That's the ideal, yes, integrating them proactively.
So just to kind of wrap up the main points, what we've really dug into today is that compassion fatigue is this specific, almost insidious kind of emotional exhaustion. It comes directly from being repeatedly exposed to the suffering of others. It's different from general burnout and has these really tangible, far-reaching impacts if it's ignored.
Precisely. And understanding its unique signs, the symptoms, the risk factors, that's the first step. For individuals, for managers, for organizations. Because recognizing it early and then proactively using these prevention and management strategies, we talked about self-care, boundaries, support, mindfulness, that's not just about the well-being of one person. It's absolutely critical for keeping these vital, caring professions sustainable and effective for all of us.
So Thinking about everything we've discussed, here's something to leave you, our listener, with. What really stands out to you about this idea of secondary trauma? And how might a greater awareness of compassion fatigue across society actually change how we support the people who dedicate their lives to caring for the rest of us?